Good morning, everybody. My name is John Menninger. I'm a retired faculty in the College of Liberal Arts and Sciences, and it's my pleasure to welcome you here today to the Parkview Church for the meeting on benefits sponsored by the University of Iowa Retirees Association. A number apparently have asked about how one should find out about this meeting, and if you join the University of Iowa Retirees Association, you can be informed. And we'll be out in the lobby afterwards to tell you how to do that. First thing I want to do is to thank the Parkview Church for allowing us to use this beautiful and convenient facility with lots of parking. Jeff Gilmore, the senior pastor, Deborah Meadows, the pastoral assistant, Jim Douglas, the church administrator, and Don Kaiser, the technical director, who is handling the video recording of these proceedings that will be available on the UI TV channel. Exactly how and when it'll be available is not yet clear to us, but if you're on the email list, you will find out. Probably on the UI TV website, you can find out also. Not only can you see the entire recording, you can stream it on your computer at a time of your choosing. You don't have to watch the channel to do it. You can drop it into your computer, and the instructions for that will be on the website also. Well, today we're going to talk about benefits. Everybody, at least I got a note in the mail yesterday from the benefits office reminding us now is the open period. And today all this is going to be brought to greater clarity by our speakers. The first of whom is Richard Saunders, the Assistant Vice President for Human Resources and Director of Benefits. He's the man, he's the expert, he's been here since 1986, and he knows everything you need to know about these issues. So, without further ado, Richard Saunders.
Well, good morning, everyone. I'm happy to see the crowd we have today. We felt that we weren't sure we were going to have a meeting until about a month ago when we moved forward and decided to offer a Medicare Advantage plan. And I thought, well, this will make everyone very interested. And so thanks for coming on such short notice. It was short notice to get everything out and done so quickly. On our UI Choice plan, which most of you do participate in. And the program today is primarily, of course, for retired faculty, professional, and spouses of those individuals. If you're here and you do have the state of Iowa retirement plan, this will not affect you at all. So I want to make sure that we're addressing totally the right audience here. But we had a small increase in our rates for UI Choice, and if you got the mailing or you saw the brochures that were sitting out front, for people who are 65 and older, it's basically about a $19 a month increase. And we are still continuing to see growing claims associated with our retiree population, which is not unexpected, of course. Basically, for the people under 65, the rates will remain as they are, so there has been no change there. In the UI Choice plan, there is one change that occurred, and it was as a result of a national Blue Cross change. So it does affect you all. And it really, what it does is currently, as you know, under UI Choice, we have three levels of providers. Level 1, which of course is the university, our clinics, our CMS clinics, Court Care, and as of last year, we have our alliance partners, Mercy of Cedar Rapids, Mercy Des Moines, and the Covenant Centers in Waterloo and Cedar Falls. But level 2 was all the other providers in the state of Iowa who had participated with Blue Cross, and basically that's 100% of the hospitals and stuff. And level 3 basically was care outside the state of Iowa. And for care outside the state of Iowa, people did pay more. And you also had a separate out-of-pocket maximum that was counted towards the care received in those cases. Now, what Blue Cross has done is basically said that if you go to a Blue Cross provider out of the state of Iowa, that your expenses incurred, that percentage will not change. You'll pay more, but the cost that you spend will apply against your out-of-pocket maximum in levels 1 and 2. So it will no longer be for people who do spend sometimes, say, down south in the wintertime and stuff. You won't have two separate out-of-pockets now. Everything will blend towards the one. So it's still important, though, if you're out of the area, that you do try to get to a Blue Cross provider, because that indeed will save you money over the long run. That really is the only change in our UI choice plan. In the dental plan, again, there was some small rate increases. If you have just a single dental plan, it's going up just $2. For a retiring spouse, it's going up about $19 a month. And for if you have a family, it's about $7 a month. The adjustments here are basically, this is now going into our second year of how we redid the, when we combined the dental plans together. We weren't quite sure about how the rates would work out. So this is kind of an adjustment to that usage pattern. So it would be surprising if we see a major increase like the employee spouse in the future again. So I think this is more of a one-time adjustment. But basically in dental, there are going to be some fairly substantial changes to the plan design. And basically there, what we're going to be doing is adding what's called a carryover function. What this means is, starting in 2015, if on parts 1 and 2, which is basically your preventative care and your restorative, like fillings and root canals or crowns, if you do not end on the braces part, so if you don't use all your care, like there's a $2,000 maximum for the parts of restorative and orthodontia care. If you don't use it all now, starting in 2015, whatever you don't use of the 2000 will carry over into 2016. So that will give you more money in the future to use if you need dentures down the road or whatever type of care you might need, or an implant. Those things are very expensive and run about $2,000 a tooth, and so this way individuals will get more care. So it's basically allowing that number to build. It won't build any more than double the annual limit, so the most it will go up is to $4,000, but it will allow you to get more care in the dental arena. The other thing we're doing is in the, basically in the way the network is designed. Currently, under our dental plan, you either, if you're a Delta dental dentist, you're in the plan. If you're not a Delta dental dentist, you're out of the plan. And so what we're going to do is add a separate tier, a new tier 1, which we're calling it. And that is for dentists who are involved in a new product called a PPO line. And about 50% of the dentists in the state of Iowa participate in the PPO product. Basically, like our School of Dentistry, those individuals who are in general dentistry, pediatrics dentistry, are in the PPO network, but currently the specialists are not. So it depends on who you see. Now, you can figure out who your dentist is if you look them up on Delta Dental's website. Every dentist is listed, and underneath their name, it just says they're in the PPO network, or if it doesn't say that, that means they're not in it. But by going to a PPO provider, basically the PPO providers are giving us about a 20% discount up front. So you'll save money if you use one of those dentists. We save money also. So it's to your advantage if you wish, and a lot of times people don't want to switch their general dentist because they've been with them for many years. but a lot of times they will send you to a specialist because a lot of dentists no longer like pull teeth. They don't do orthodonture, they don't do dentures. They send you to somebody else now. And so that's where picking a specialist is important in how you get your care, because it could save you 20%, and that could be a pretty substantial amount of money. So you'll want to look at that. That's kind of what's going on in our health and dental plans. And then what we've done then is decided this year to move into the Medicare Advantage product line. And this is a result of the University of Iowa's Health Alliance program that they established with the other institutions that I mentioned. And as a result, they are creating a product line that will allow individuals various network options. And what we did was we selected, worked with them and picked out 2 products, similar but different. And one of them is quite different than what we offer now with UI Choice. But like we've talked about in the past, if people left our UI Choice product as a retiree, they could never come back. Because once you made the decision to leave to go out to another product line, you'd have to stay in that product line or stay within the various plans that are offered on the federal level. Because this is going to be with the university, because of the alliance, we are going to allow people to move back and forth. So every year during open enrollment, which will come now, in the month of November, you can decide, do I want to come back to UI Choice? Do I want to go with one of the Health Alliance products? So that gives you the option and the flexibility to experiment, if you wish, to test out this particular product line. And if it doesn't work well for you, to come back. But you can't do it during the year. You'll only be able to do it at open enrollment. So you can't say this month I want to be in UI Choice because I got to go to the hospital. Next month I'm going to want to switch back to the other product. So it is a once-a-year decision. But I think the option for you is going to be something that needs to be seriously considered. You need to look at not just the premium price, but also the usage pattern. How do you get your care? Where do you get your care? Do you travel a lot? Do you not? All those things need to be factored in. And there is a limited open enrollment period, so you need to keep that in mind to make your decisions. At this point, I do want to introduce a gentleman from the Health Alliance who's going to explain their 2 products. Then when he gets through, we'll be both here to answer questions. There's going to be a lot of questions. We understand that. We do have a limited time for questions, but we'll stay around to answer questions that we didn't get to. So if you just want to be patient, I'll get to everybody's questions, okay? So at this point, I'd like to introduce David Zahn from the Health Alliance program, and he will go through his products.
Thank you, Richard. As he indicated, my name is David Zahn. I am with Health Alliance Medical Plans. We are based out of Champaign-Urbana and are pleased to be offering 2 additional offerings this year to the University of Iowa retirees. And I'm going to spend about 20 minutes, 15 to 20 minutes going through what those 2 options are. Again, would stress they are in addition to the current plan being offered, so it's not that these are the only 2 choices. These are just 2 additional choices. A little bit about who Health Alliance is. We've been around for 30 years, again, based out of Champaign-Urbana, Illinois. I still am a University of Iowa graduate, so I still cheer for the Hawkeyes. I have not become an Illini fan. I'm actually based out of Des Moines, Iowa. So we've been in the Medicare product line business since 1997, so we've been doing this for a while. Currently have just about 20,000 Medicare Advantage members. And we've received the NCQA Excellent Accreditation for our Medicare HMO plan since 2002. Talk a little bit about the 2 plans. One of them, as Richard mentioned, is a PPO plan, and we tried to match it as closely as possible to the current plan offering. I would mention the network is the University of Iowa Health Alliance, so it's University of Iowa Healthcare, as Richard mentioned, Mercy, Cedar Rapids, Mercy Des Moines, and then Mercy Mason City. So it is a network-based health plan. We're offering the PPO, and that is $279 per month. And then we're also offering an HMO plan. The benefits, and I will touch on some of the highlights here in a minute, are very different, but that premium price on the HMO Plus plan is only $39 a month. So talk a little bit about those. The PPO plan, the annual out-of-pocket maximum or yearly limit is $1,700. So I believe similar to the current offering. There are no deductibles on either plan. The yearly limit for the HMO product is $3,500. Talk a little bit about office visits. For the HMO Plus plan, the primary care office visit is $20 and the specialist office visit is $35. Lab and x-ray are a 20% coinsurance. For the PPO plan, it's $5 copay for primary care or specialist, similar to the plan today, and then 10% coinsurance on the lab and x-ray services. Emergency room visit, $65 on the HMO Plus, and on the custom PPO plan, it's $50 and then 10% coinsurance. For outpatient services, on the HMO plan, there's a $175 copay, and on the custom PPO, similar 10% coinsurance. Talk a little bit about the prescription drug coverage, and again, as Richard said, we'll be here to answer questions afterwards. I also have some additional people with me in the back of the room that will be around for questions if you don't want to ask in the group and want a one-on-one question. Just look for any of us with the name badges. We'll be happy to answer questions for you. On the RX plans for the Guide HMO plan, it's an $8 copay for Tier 1 generics. Tier 2 is $33. There is a deductible on the Tiers 3 through 5, and that's a $20 deductible on the HMO. Tier 3 copay is $45, and Tier 4 is $95. On the custom PPO plan, $0 Tier 1 generics, and then 30% coinsurance for Tier 2, and then 50% coinsurance for Tiers 3, 4, and 5. Would mention that there is no coverage gap on the custom PPO plan, but on the HMO plan there is a coverage gap that after the total costs from what you've paid and what the plan has paid reach $2,960, you would enter the coverage gap, and I won't spend a lot of time on that. Some of you did receive packets. I know we ran out. My apologies. Great to see a big crowd. You will receive a mailing. We were hoping it would get to your homes before today, but it did not, so I think it's going out this week, so you should receive a packet on Saturday or early next week, exactly the same as what we had available today, and so it will have all of this information in it. Some of the extras that are included in our Medicare Advantage plan, we do cover a vision, eye exam every year, participation or benefit with Silver Sneakers, which is a fitness program, both fitness center, and then they also have an at-home kit that is available to everyone that's enrolled in our program. And then a program called Assist America, which is basically assistance with emergency care when you're traveling more than 100 miles away from home. So if you do decide that one of these two plans would be a good fit, you can either enroll over the phone, and that number will be in that packet, or there will be an enclosed application within the packet that you can mail back to us in the envelope that's included with that. And with that, I would just like to thank you for your time this morning and open it up for questions. Oh, one more thing.
Just a few other comments. He went through it pretty quick, and we know that this is not a quick decision. And what you need to really look at, we've heard from a lot of people over the years, of course, that under the university's health plan for retirees, some of you receive a contribution and some don't, based upon your age and length of service when you left the university, and also if you're a spouse. In other words, there is a current payment that we pay approximately 50% of the premium or for individuals who left us after the age of 62 with at least 10 years of service. Everybody else has to pay the full price. So the full price is, over $500 a month, and we understand that. We've seen a slight decrease in our enrollments every year in the UI Choice retirement plan, and we understand a lot of that's due to sometimes to the cost issue. And so one of the attractions of this program, as he mentioned, is the rates that he quoted. The PPO product is similar to what the employee, the retiree who gets a contribution from the university pays. It's still slightly higher, but very close. While the HMO product is considerably cheaper. So, this vehicle gives you the option, like I said, to test this product if one of these, if you want to look at it. It's important to really understand who the providers are and to look in their materials, their system out there, and to say, well, I'm using this provider. Will this provider still be in the network? Are you willing to change a provider? Because again, to get the lower prices basically means there has to be a reduction in the amount of benefits that you receive and how you receive your care. Otherwise, everybody would have the same price at $39 or whatever, And so that's what's important. How you use this care, where you get it from, is a factor that you have to seriously look at and understand before you make the decision. And so primarily the providers are the University of Iowa. And we understand most people here, of course, are from Johnson County today. And so you have to look at that and say, is this what and how I get my care? And so where the UI Choice model, you do have the option outside of the university to go wherever you wish. And so these are considerations that you have to do. And so you have to look at that. You have to, if you have a spouse or partner, it's, does one person stay with UI Choice? Does another person try the other new plans? Because maybe you don't use much medical care, and the difference of the premium is really substantial. You look at the difference and say, well, do I use $300 or $400 a month in medical care? And all those pieces go in there. In the same way with the prescription drug program. The prescription drug program is a little more complicated. You have to understand where your particular drugs currently fall and which tier, because they have multiple tiers. Where we have a very simple one. So it's looking at that. It's talking to them, because to be quite honest, we at the benefits office really can't answer questions about their stuff. And so it'll be addressing the issues directly with them through their 800 numbers at the meeting today, because we know that you're not all going to think about questions today. You have personal issues that you'll definitely want to talk to them about, and you can do that by calling them directly and saying, here's my situation, The other thing, because of the flexibility of being able to come back, you can try it. If you want to, if you experiment, you can feel free to do that and see how it works out. So those are the few things I do want to emphasize back to everyone. It's a simple explanation, but it's a complex decision that you need to make. And so we tried to be as brief as possible to have time to spend with all of you, whether individually or in group questions here, to try to clarify a few points so that you understand. So if you do have general questions, maybe about the local network, about things like that, that we can answer for you, but if you have personal questions, hang around when we're all done, because we can get into those personal questions.
Okay, let me explain how the questions will work. I'll be handing a microphone to you to ask the question so that the TV audience later will be able to hear it, and Beverly Robolino will use the other microphone. We'll be wandering around shoving microphones back and forth. And they will be turned on and off by a technical expert rather than by you or me. So Beverly will get the other microphone. These gentlemen will stay here and answer the questions. Okay, here's question number one.
Out-of-pocket include international? Excuse me, out-of-network means also international.
For the out-of-network benefit, it would be a separate out-of-pocket maximum and higher on the PPO plan.
Include another foreign country.
It would be, yeah, any out-of-network
So
care.
out-of-network is anywhere in the world.
Anywhere that, correct.
Is fortunate enough to get the benefit from the university. Is that applicable to this new program? That 50% reduction in premium?
No. The 50% reduction that employees get that I mentioned earlier does not apply because already that would mean we would pay you to be in the HMO. So, but yeah. But no, it's only for the UI Choice product. This is one of the things that's attractive in that for both you and for us, because to be quite blunt, we're going to save the $250 that we're paying for employees if they go into this product. You know, you get a much lower premium price that you'll have to pay, but then we also save. Pardon me? If you got it before you switched, you'll get it when you switch back. So your risk is really not, you know, it's really trying to figure out do I want to try this, you know, for a year? Does it make financial sense for me to try it, to take a chance for the year? And the idea being that I know I have a safety net that I can come back and I don't lose anything that I have now. And dental has, they don't do dental, so the dental plan continues. Now, one thing I wanted to say too is that if you decide to go with them, they will bill you. It does not come through the University of Iowa. We will only bill you if you keep our dental insurance. So if you go them and you select one of those products, they will set you up for an automatic deduction from your checking account or whatever, but the money will not come back to us, okay? They will tell us who you are, so we know that that way we will allow you to come back because we have to know who's going away. And so, but that's how it will work for the payment of their premiums.
What was that last bit that flew by on more than 100 miles from home? Was that for custom PPO?
That's on both plans. It's Assist American. It's just an extra benefit. So if you're in a foreign country and have an emergency situation come up, it's a program that a vendor that we utilize to help with translation services, transport. It's an extra benefit. It is on both of the plans when you're more than 100 miles away from where your home is.
Questions here? What about Mercy, Iowa City? There's been nothing said about that.
That's a great question. At this time, Mercy, Iowa City is not part of the University of Iowa Health Alliance, so they would not be in network at this time. Those conversations are happening, but right now, as of today, they are not part of the Health Alliance.
Will it be before the start of 2015?
No, I would, if I were to guess, I would say no, it will not be before 1/1 of 2015.
Yeah, this is important because if you do utilize the physicians in the community, like in Towncrest or whatever, they will be considered out of network. So you want to look at closely of who your providers are and what it will cost you to utilize those providers if you can use them. Now, can they use them?
I received a letter.
Well, can we say
I
one more
wanted to
thing?
do one clarification on that too.
Oh.
There is an out-of-network benefit on the PPO plan, but on the HMO plan, there is no out-of-network benefit except for emergent or urgent care.
Which means that if you pick the HMO product, which is the cheapest product, you basically have to use the University of Iowa if you're going to be living in this area. That's one of the big restrictions you got to keep in mind. You can't go to Mercy Hospital. You can't go to the Mercy physicians. So again, it's a trade. Like I said, you're trading something for something. You're getting a $39 premium, but and for a lot of people, they get all their care at the university now anyway, so it's kind of irrelevant to you. But you have to look at, are you willing to trade your physician? And if you are or aren't, then you have to look at, well, I really want to keep my physician. You might want to consider the PPO, but then you're going to pay more. So you have to take that into effect.
Yes, I have a question. Every year we get on UI Choice a letter saying that we have credible alternative Medicare D coverage for prescriptions. Will that be true for the Health Alliance plan too?
Yes, the Health Alliance plan does have credible prescription drug coverage on both of the plans.
Yeah, the letter I received stating that my doctor was a participant in an exciting new Medicare Advantage plan, so on, from the Health Alliance. And at the bottom of the page, it said that the generic drugs that we now get for free would be available also for free at Walmart and Sam's Club. And if one has an aversion to patronizing those stores, does that mean we stay with UI Choice?
The Tier 1 generics, so on the PPO plan, they are zero, as long as you're going to a participating pharmacy. The Sam's and Walmart that you mentioned is just on the Tier 1 generics for the HMO plan, but for the PPO at any participating pharmacy, it would be a $0 copay.
Is this on? 2 questions. I think I know what PPO stands for and HMO, but it seems fundamental to define those terms because we're talking. And the second question, what do you know about the SHIP program, an acronym, the SHIP program that's offered at the Senior Center, which I understand advises people for the drug supplement on Medicare and also assists people in reviewing the process of choosing?
You bet. Thank you for the question. HMO, Health Maintenance Organization, so it's a network-based health plan type, PPO, Preferred Provider Organization, so there is an out-of-network benefit with that plan. Regarding the SHIP office, some familiarity with them in that they will obviously help answer questions. They are not biased. They cannot push one plan over another. Off the top of my head, I can't recall what it stands for, Senior Health Insurance, something, yeah, but I don't know a lot about it.
Yeah, basically it's a reference place for individuals to go when you're looking at, and if you think about individuals outside of, say, our employment relationship that you had here at the university, you could have 25 different plans to select from. And their job is to help you understand the various options that are available to you. And so they're there like we are, like David's group is going to be, to particularly answer those kind of questions. So SHIP is really a good product, a good area, I should say, to go to if you're really looking at exploring the options outside of the university.
Two questions that we have here. Let's go back to the international. You talk about emergency and urgent care, and this sort of goes to both of you. It's unclear if there's any benefit beyond a crisis situation once you're out of the country, and is there any coverage for that kind of situation under CHIP? The other thing relates to this whole bit is if a lot of people go with the HMO and the PPO, which reduces the number of people in CHIP, is this going to ultimately drive up the costs of the CHIP program? So 2 questions.
And I'll take the international question on coverage on both the HMO and PPO. It would be emergent or crisis situations. I would clarify that to say a sinus infection is considered emergent. If you don't get that treated, that can be potentially life-threatening. So that is an example of something that would be covered internationally. Routine lab work or physical therapy, for example, would not be covered internationally or out of network. So just as a couple of examples.
Okay, emergency only.
Correct.
Under the UI Choice product, it's good worldwide. To be quite blunt, it's hard to work overseas with claims. There are on the website, Blue Cross does have an international directory. They do have hospitals, and primarily hospitals, but some physicians that do take your Blue Cross card. We do have retirees who live overseas. We deal with their claims all the time because it can be a real big problem trying to take care of it. So if you're just traveling on vacation or something like that, where you're going to spend a summer someplace, you're going to be covered. You might, in some countries, to be quite honest, we know that they don't take insurance. They don't take credit cards. They take cash. And we've run into people who all of a sudden, have to go to the embassy and everything else and try to get cash because they don't take any other form, and they won't treat you until you pay. And so you have to really recognize the situation, especially some of the countries surrounding Russia are problems. And so it's just picking and making sure you do some homework up front. Are there Blue Cross hospitals in that country? Is there something unusual that you need to learn to talk to the feds about, learning about the health care that might go on? Eventually, you'll be reimbursed when you come back, but it could be a situation that could develop when you're over there, though.
Oh, but basically what you're saying is the coverage is there. The question is how you pay for it and when you get paid.
That's correct, yes.
Hi, my name is Erica Williams, and I'm with Health Alliance. And I just wanted to speak real quickly to one of the questions that was asked from the front over here regarding a letter that I believe the lady had received from Health Alliance, and it prompted her question about the coverage at Walmart and Sam's. We also have individual plans, so somebody who might not have an employer group that would offer them coverage, Health Alliance offers a lot of individual plans, and this is the time also for people to enroll in those plans. So what the lady was referencing earlier was a letter from Health Alliance talking about our individual plan that is not related to the plan either of the plans that are being offered here through the University of Iowa. So I wanted to clarify that because we tried not to mail to people who we knew were retirees because we didn't want to make that confusing, but it wasn't possible to get everybody out of that mailing. So you might receive other information from Health Alliance, and you are probably receiving information from a lot of companies right now because this is the Medicare sign-up period. So just try to pay attention to what information is on the mailings that you're getting. The packets that some of you took today when you came in, the white, large white envelope, that's the communication that will be sent to your home. And from Health Alliance, that should really be the information that you're using to look at and evaluate this option. If you receive anything else from us, you can just disregard it because these will be the benefits that will be tied to your retiree plan. Does that make a little bit more clarification? Please feel free to ask any questions you might have off of what I've just said too. So.
Yes, it's also, I'm over 65, and I get, as all of you do, I assume, all the mailings from Humana and Blue Cross and Health Alliance. I got 2 mailings from them, actually, talking about their products that they're selling to the public. And we want to make sure that you understand that the only way you can come and go within our program here is you have to participate in the University of Iowa Health Alliance products that we're offering through Health Alliance. In other words, if you bought their public policy, that would not let you come back. So it's important to watch the communication that you're getting to make sure that it has the University of Iowa Benefits Office or something on the envelope, on the logo, on whatever, that clarifies that it is coming through us and not through the public mailing that they send out to everybody. And that'll be true in the future each year too. as those mailings continue each open enrollment period.
I have two questions. One is, does that being able to go in and out of the plan something that's likely to continue, or is that just something for this first year? And the other question is, as I recall, as there used to be more plans when I was working, there was always a chart that came out with from your office, Richard, that sort of compared the different plans and what the benefits were of them. Will there be anything like that? That was a helpful tool.
Let me say that at the present time, as long as both sides that agree that this is still going forward as a product of the UI Health Alliance concept, because it's part of our hospitals, College of Medicine, and the university's alliance program that has been formulated and created for the state of Iowa. And as long as that's going forward, we're going to continue with it as long as the product's being offered. Yes, we anticipate that it will go forward into the future, but again, that could change, and of course we would notify you and you could come back or whatever, that type of thing. On the comparison chart, we did send out the UI Choice product because we just, at that point, the first year, we're not quite ready we wanted to let them talk about their product. In the future, we'll try to combine these, but we got to make sure that we clarify that only UI Choice is the one product that we have right now. There's seems to be any desire at the university at the present time to create multiple products still. We're just going to stay with the UI Choice product. And we always kind of hate to bring in and show outside providers with ours, but we might try doing that as a comparison in the future.
I have two questions. The first one is that you didn't answer the second question that this other gentleman over here had about what in the future will happen to UI Choice because people, most likely more healthy ones, will sign up for maybe one of these plans, leaving less healthy people in the university plan. And the second question is, how can you explain a monthly premium difference of $528 per month versus the $39 per month? The difference there is huge, even considering the different copays.
What will happen with UI Choice? Well, we never know. It depends upon, it's a university policy program. It's a university decision. We still have, I think it's 3,000, over 3,000 retirees in our program. And a lot of retirees don't live in Iowa. Yes, there's probably 250 people sitting in this room. But there's a lot of retirees who live in other parts of Iowa. We have retirees in every state. We have retirees who spend 6 months of the year here and 6 months of the year down south in the winter. We have retirees who live overseas. So there's a lot of people this program makes absolutely no sense to. And will everybody want to switch? Well, if you're getting the contribution, there's a difference of, their plan is, maybe $20 more expensive. So you look at it and say, well, how many people will leave? We have no idea. It'll be interesting to see how many of you all want to experiment. Are you willing to take the jump? So we'll learn a lot after this first enrollment period and maybe the second enrollment period. As my assistant Deborah Hughes says, oh, great, they offer silver sneakers, because we hear about that all the time, And the exercise, the ability to use those exercise programs, I think it's the Dodge Street Club and one other place in town offers you membership with that. That's free. So there are things that, that go into this whole decision-making program. And we don't know what's going to happen, and it'll be interesting to see, how many of you are going to make this kind of a move. So the difference in the premium is the difference of the benefits. The UI choice problem, because of where everybody lives, there's all kinds of different contractual rates, there's different hospital rates. We live in a pretty inexpensive place to live in Iowa for our health care costs. That's not true for our people who live in San Francisco or New York City. And we have a lot of retirees in the Northeast. Their care is very expensive if you go to Boston. And so all that drives the price. Also the benefits. I mean, for you all in this room, you look at it and say, well, I can use quick care for no cost. I can get free immunizations. I can get a physical every week if I want one. There's a lot of incentives that are built into that program that do raise those premiums versus what you can find in other products. That type of thing. So if you look at the PPO plan, that's much closer. They do have some of the similar type benefits. You don't have a closed, limited network, that you will get. So there's pros and cons either way. But the claims, of course, and the premiums are totally based upon the population of the retirees who are over 65. That's who determines the prices of the premiums for this particular product. Yes?
Currently, my Medicare, my UI choice has my primary carrier as Medicare. Is that the same with an HMO and a PPO? Will that be the primary insurance, or will Medicare be the primary carrier?
So with our plans, as a Medicare Advantage plan, we become the payer. We receive a payment from Medicare, and then it's our responsibility to pay all those claims. So if you did go with one of our plans, you could tuck the Medicare card in a drawer for the year, because we do become the primary payer on all those claims.
Could you expand a little bit on how it's possible to offer a plan that's essentially the same as UI Choice under Medicare Advantage for about half the cost?
So Richard answered last time. I'll take a stab at it this time. Benefits are similar. They're not the same. One of the biggest differences is network. So with the UI Choice plan, you can, if you're in Arizona and you want to get your physical or labs drawn every month for medication monitoring, that's going to be covered on the UI Choice plan, whereas with ours, it's going to be an out-of-network benefit if you're on the PPO, or not covered at all if you're on the HMO. So that, to me, that's a big difference in benefits. On the PPO plan, I went through, just because I didn't want to take too much time, the in-network benefits. The out-of-network benefits, there's significantly more cost sharing. So typically 30% coinsurance, higher annual limit, and so the benefits are very different than the UI Choice plan, and the network is obviously limited to the University of Iowa hospitals and clinics.
And like any plan, when you create a plan from scratch, you're always going to have to wait and see the experience that plan incurs. And there's probably, and you hear it in the press constantly, on the federal Affordable Care Act plans that are out there, that small employers participate, or individuals. Everybody, you have 1 year, then you can adjust the premiums to reflect the actual usage of that plan. So it's always a guess the first year. We never know what's going to happen. They don't know what's going to happen. They base their experience on dealing with a retiree population. And is our retirees reflective of the typical retiree that exists out there? I think for the most part, actually, our retirees, you people, are in much better health and in better shape than most retirees. And we see that dramatically with the state of Iowa comparison that our merit staff have, and that the rest of the state employees. The premiums are double ours, and so I think that that tells us a lot about who we are, and it might change how a plan for our retirees is going to differ in prices from their experience of other retirees. So it just takes a little while to work through the premiums.
So for me, maybe for others here, the biggest concern I have is an annual OPM. You know, we're blessed by a good university retirement system also, pensions. So I don't care much about small differences between plans, $5 here, $5 there. What I personally care the most about is having an annual cap on what all of my medical expenses of all kinds, drugs, hospitals, doctors, whatever, could be. And so my question is, between the UI choice and the alliance plan being offered, what are the total gross maximum annual caps that we might have?
I'd be guessing, and I won't, because it's going to be different. I mean, the maximum for the custom PPO is $1,700, but that does not include drug. So you've got to keep that in mind. On the HMO, it's $3,500.
No,
Also,
just the PPO. I don't even.
Just the PPO would be the $1,700, and then whatever the whatever individual prescription drugs you might take. That's why I say it'd be difficult to do for in total, because it's going to be different for every person.
So in the PPO, there's not an annual cap on drug for out of pocket?
There's the I have to look. Bear with me. There's no coverage gap. I don't think there's an annual out-of-pocket.
So, you know, it's going back to the whole concept, the rate's cheaper, why? You know, and out-of-pocket, you're right. To hit the out-of-pocket for most people on the medical side, you're going to need to be hospitalized or very, very ill to hit that $1,700. But on the drug side, you know, our out-of-pocket's $1,100. And here on the plans, there is none. And it's similar to Medicare. When you look at the basic Medicare plan, there is no upper limits. You just continue to pay and pay, and you are at the risk of participating in those plans. And so, again, that drives the premium, because if someone, and it's not unusual, we see, I think we've had 3 claims so far this year over $1 million. Okay? And last year we had one over $3 million. So if you have no upper limit and you're paying 20% of that, that's one of the problems. That's why you have the insurance plan, is to protect you. And it's part of what you're looking at and trying to make decisions. Yeah.
Oh. Okay. Yeah, I have a question. You mentioned that you would be taking over the payments from Medicare, and I was wondering, does that mean that we would still make our Medicare premium payment?
That's a great question. Yes, you'd need to continue to pay your Part B premium. Excellent question.
To add to that, there's been a lot of question about how we can offer that $39 premium or the other premium on the PPO plan. Come up front. Sorry, I'll come up front so you're not turning around to look at me. And that truly goes into how the Medicare plan works with Health Alliance. So we do, if you're going to choose one of the Health Alliance plans, you continue to pay your Part B premium to Medicare. And Medicare, in turn, gives some of that money to us to help us administer the plan. So Health Alliance pays the claims, so you'll still have Medicare, you'll still pay your Part B premium, but Health Alliance will pay your claims, and then we also use some of, Medicare gives us some of the money to help us pay those claims. So together, your premium and what you pay to Medicare and then Health Alliance, all three of those things go together to pay your claims. And so that's why we can offer those plans with still good benefits at a lower premium amount. So hopefully that helps take care of that. But back to the original question, yes, you do need to continue to pay your Part B premium. Also, a little bit more clarification on the out-of-pocket limit. There is an out-of-pocket limit, as Dave said, on both of the plans. So on your medical, there is going to be a point in time where you're not going to have to pay anymore. But Health Alliance continues to pay. That's a cap for you. That's a protection for you. And on the pharmacy side, the pharmacy does work a little bit differently, depending on which plan you're on. But there is a point in time where you'll get to a catastrophic limit if you have enough pharmacy claims, where your copayment would be reduced down to a much smaller amount. And you can see that if you look in the summary of benefits under the catastrophic phase of the pharmacy coverage.
The hospitalization part is the big money thing. I've had one surgery that cost $40,000. Between UVI Choice and Medicare, they paid $20,000, and $20,000 got, say, eliminated. Then I went to Steiner Clinic. The other surgery was $20,000. They only paid about $10,000, and $10,000 disappeared. How about the PPO plan? Will these $40,000 things and $20,000 surgeries be covered completely with the PPO and Medicare?
Yeah, on our PPO plan, it would be the 10% coinsurance after a $400 deductible per admission. So we tried to match on the PPO plan as close as possible to the current UI Choice plan.
Yes, my questions.
Go ahead.
Go ahead, Richard. My questions are primarily for you, Richard. You've mentioned the $19 increase in premiums on the medical side and $19 increase in monthly premiums on the dental side. For a husband and wife and on medical and dental, that approximates $700 increase in premiums this coming year. Is that correct? For a second. I have my questions written down here. The Medicare, or the Obamacare program was counting on $700 and some billion to be carved out of Medicare. And my understanding has been that it was primarily in the elimination of Medicare Advantage, which is the HMO and PPO products we're talking about today. Has that concern gone away?
I'm going to defer to my Medicare expert in the back of the room who's right next to you right now, Jana Perry.
And I'll walk up to the front. Good morning. I'm Jana Perry, and I'm Vice President of Customer Service and Consumer Products, which includes Medicare. That's an excellent question. So the ACA did have reductions in Medicare costs around Medicare Advantage, but it wasn't to eliminate Medicare Advantage. It was to bring the reimbursement that Erica just spoke to down to what's referred to as fee-for-service. So Richard talked about the fact that we're in a county that is lower cost, which is a great thing. That means everyone's a little healthier. But so what that means is what's paid under fee-for-service or original Medicare, CMS or the Centers for Medicare and Medicaid Services is paying Health Alliance a lower rate. But it still is figured into the premium. So Medicare Advantage is thriving. There's a lot of enrollment going into Medicare Advantage. But it was the savings was to reduce the amount coming to the health plans. But that's already been calculated into the premium. So I wanted to add on to that. And I also wanted to clarify the question because you do have, when you're looking at your options, you do have some benefit plans that have coinsurance on them. So Coinsurance means you're paying a percentage of the charge that Health Alliance gets. The really good news for you, just under Medicare Advantage as well, is we are reimbursing our providers at Medicare allowable. So on that $40,000 example, Medicare sets the allowable, that's set at the federal government level. We get to take advantage of that same discounted rate. So if you're paying for a service that has, let's say, 10% coinsurance and the charge is $100, and the allowable is $50, you're paying 10% of $50. So we pass that savings on to you. So I wanted to make sure I pointed that out as well. Okay?
I have two questions. One is, does the coinsurance that you pay contribute to the out-of-pocket total? So if you have spent $2,000 on copays, which wouldn't take long if you see physicians very often, you pay nothing more.
Coinsurance would apply to the out-of-pocket max. I do not believe everything. Copays too. So copays and coinsurance would count towards the out-of-pocket.
Okay.
Thank you, Jana.
Okay. And pharmacy is separate. Okay.
Yep, medical, every medical copay and pharmacy copays, though, would be separate.
Yeah, the other question on the whole Medicaid, the Medicare Advantage plans, too, is that, you know, they're experimenting with everything possible to try to control medical care costs around the country, and trying to move away from the fee-for-service model. Which basically increases costs dramatically to the employers, to the government, and to the individuals because providers are paid to do more, run more tests, do more exams, do more surgeries or whatever. And so it's a challenging environment we are in, and what will happen in the future, it's hard to say. I think there's a lot of experimentation going on. In medical homes, as they call some things, as the Medicare Advantage programs, as drifting back towards the old HMO model, which was limited networks. A lot of that is occurring. In other words, if we can look at something and say we can get a better deal if we send all of our people to a certain provider or a certain hospital. That's the challenge everybody's having is, where will the whole healthcare environment end up? It's hard to say. It's really a guess at this point, and I think everybody's struggling with that. And so prices, I'm afraid, are still escalating upwards because most people still work, and providers still work on a fee-for-service model rather than, again, it's similar conversations. There's an ACO model out there, accountable care organizations, which the University of Iowa hospitals and clinics have. They participate with Medicare's accountable care organization. They participate with Wellmark's accountable care organization. And there's also a Health Alliance accountable care organization. And so people are looking at these things saying, well, maybe instead of paying a certain amount for certain procedures, we'll say it for a whole service. In other words, there's one flat amount if you need to have a knee surgery or a hip replaced, rather than having 8 different providers bill you 8 different things. So there's models being tested nationally and locally to say, you know, do these actually work? Are they successful? Hopefully, the providers are trying to say, too, as long as we can make some money, but we don't lose money on it, you know, they're all looking at things. So I think there's going to be lots of conversation over the next 3 or 4 years before I think all this straightens out. Yeah.
Richard, I just had one further question, and really is directed to you, of course. That is, you mentioned that the UI choice rates for 65 and age 65 and older were going up $19. For those under 65 were remaining the same. This is the first time I've been aware that there's a distinction in the rates between over 65 and under 65. Has that been true all along?
Yes. Let's see. I've been here since 1986, and it's been that way ever since.
19 what?
86.
86.
So it's always had a differential rate between the plans that where Medicare becomes primary and we're secondary, and the plan where the employees don't have a primary health insurance. Yeah.
Okay, thank you.
This wasn't to be my question, but when you're talking about that, this $19, the only $19 that I saw was the raise in dental from 65 to 84. Is that correct?
I think if you look at the premium increase of the UI choice went up I think it's $19, the total from last year.
But
There
that's
was an
all dental.
increase in the single premium of UI choice for individuals 65 and older. Under 65, there was no change.
Okay, my real question here, though, is my husband retired 2 years ago, and I was told that on the Medicare and the U of I choice, of course, he met all the requirements to have it at 264, and I'm a spouse, and so mine is double. He wouldn't change. There's no reason to. I mean, but I could. But each year, I'm told we have a deductible. Now, he's had 3 major surgeries. I've had 2 major surgeries. I've never paid a bill. I've had no deductibles.
No, there's no deductibles. There is a deductible.
They tell me there is. They say you've met the 460.
Well, there's an
But
inpatient.
how?
There's an inpatient deductible if you become hospitalized, but outside of that, there's no deductible.
Okay, thank you.
Yeah.
Since the Health Alliance doesn't include Mercy Hospital in their plan, does that mean you cannot have a local doctor? And if you can have a local doctor, do you have to go to Mercy Hospital? That's number one. And number two is, if you're on the Health Alliance that you have, when you go to university doctor, do you only get a resident or an intern, or can you get a staff doctor or a clinical doctor?
You bet. No, let me take them in reverse order. So the second one would be any contracted physician at the university. So there's no differentiation between intern, resident, or chief of staff. That's going to be the same. The first question, I'm sorry, was about the Mercy doctors. They would be considered out of network, so there wouldn't be coverage on the HMO plan unless it was emergent or urgent. On the PPO plan, it would be at the out-of-network benefit level. So I believe it's 30% coinsurance for the out-of-network. So that's, you could see them, but it would be a higher cost sharing as well as higher annual limit. So wouldn't make a lot of sense, but again, you can do the trade-off with the math and see if it does make sense.
When you're talking about the hospital environment, you do have the ability to express to your primary care physician, if you wish, that whoever you're dealing with, that you only want to deal with that individual. So yes, there are the medical residents, there's the house staff, there's all kinds of people who are also trying to learn to be a physician. And we understand that you do, some people just don't want to deal with all those individuals, but that's something you just need to basically tell your provider if you're using the hospital, and they honor the choice you make. Yeah.
I retired under the early retirement plan. And I got 5 years of health coverage, which would end next spring. Do I have to decide now about what I'm going to do, or do I have till next spring to decide where I go?
Because this product is different than a typical Medicare Advantage product that's offered to the public, it's a group plan through an employer, that at the time that you turn 65, at that time, or when you leave your current program, you'll be able to make a selection at that time if you want to join the Health Alliance or stay with the UI choice plan.
And everything would be the same at that point?
Yeah, it would be whatever the cost is now. That's set for all of 2015.
Okay.
Yeah.
Clarification from Richard on this business of transferring between the Medicare Advantage plans and U of I Choice. And I apologize if you've answered this, but I think I missed it. Are you saying that if we go to one of the Advantage plans, we can at any time in the future come back to UI Choice, and that's clear and a guaranteed contractual right under the plans?
If you decide to join one of the Health Alliance products, you can come back to the plan that we have at the university. We'll just assume it's UI Choice in 2016. You can come back once a year during open enrollment, which is going on right now. So every year you get to make a choice, but it's for the next 12 months that you're in that plan.
Is there do you predict that that will change in the future? Or?
No.
No?
We need to basically maintain a length of time to develop the premium and claim structure in order to figure out how this is going to work, yeah. We can't have people moving every other month, yeah.
Oh, I'm fine with the yearly change, but I wasn't clear whether that's going to last for, 3 years out if we wanted to come back, or
Right
5.
now, there's no discussion or even thought about changing that rule. We continue to want to let people experiment if they want and try. And if it works out for them, that's fine. But we want to have the people have the ability to move back and forth. And if that would ever change, we would, of course, announce that during an open enrollment period so people would have one last decision to make, yes.
If I go on the Health Alliance website, can I find out which pharmacies I can use for both the HMO and PPO?
Yes, you could go to it's healthalliancemedicare.org, and that would list all of the pharmacies as well as doctors and hospitals. There is a copy of our prescription drug formulary included in the packets that you either received today or that will be mailed to you, but that list is also out on our website as well.
I heard you answer the questions on caps, but did you also use the word gap at some point in time?
Yes, so on the pharmacy coverage on the HMO plan, there is what's referred to as the coverage gap. So when you in the health plan, the total drug cost has reached $2,960, you enter that coverage gap, or you might have heard it referred to in the past as the donut hole, and that's until, so there is a coverage gap on the HMO plan. On the PPO, there is not. So it's just on the HMO plan that there is that coverage gap. And again, that's part of the reason the premium's, as low as it is.
So if you've reached 2,900, then you get no further coverage till the following year?
No, it's a great question. So at that point, then it becomes you're paying a percentage of the drug cost, different for generic versus brand, until you reach 4,700, I believe, and then at that point, you're in catastrophic coverage. So at that point, it's the greater of $5 or $5% or $2.65 for a generic, and I believe it's $6.60 for a brand. So you don't lose coverage in the coverage gap, you're just paying a higher coinsurance amount of percentage for brand and generic drugs until you hit that catastrophic coverage amount.
So it doesn't have anything to do with hospital or medical coverage, only medical, only pharmacy.
Only prescription.
Okay, thank you.
There's no problem with one spouse being on the university plan and the other one being on the PPO, is there?
That's correct. Individuals can separate themselves, and one can stay with UI Choice, one can go to the HMO, one can go to the HMO, one can go to the PPO. It's however you want to divide yourself up. Yes?
I have a question about it's puzzling to me that how when I turn 65, a good share of my medical expenses are going to be paid by Medicare, but the group I'm in, the rate goes up. That I'm paying more for the insurance, even though half of the expenses or more are being paid by Medicare. And I suppose it's just a function of what the claims are. Is it?
Yes, it's just the function of what the claims are. older individuals, you do have more claims and more expensive claims. And that basically drives it. It still reflects, the claims incurred for the retiree group only reflects the premiums that reflect those claims. And so you're not mixed in with anything else. And I'm afraid that's just what it is, yes, yeah.
All right, ladies and gentlemen, I think you would like to join me in thanking Richard Saunders and David Zahn. Our members are starting to drift out, and so I think I'm going to bring the formal part of these proceedings to a close. Let me remind you that the UI TV channel will have a recording of this, and we'll try to email everybody who's on the UIRA list of how to access that. I expect their website will also instruct. Now there's a coven of representatives from the Health Alliance back here who can answer your individual questions, and a bevy of consultants from the benefits office on the other side who can answer more personal questions. Thank you for coming. We are adjourned.